Welcome back. You are with Afternoon Agenda. The current coronavirus outbreak on Sydney's northern beaches only highlights how significant the arrival of a vaccine in Australia will be. Joining us live now is Dr. Frazer. He's the founding president of the Australian Academy of Health and Medical Sciences. Dr. Frazer, thank you for your time. We appreciate you joining us. We've seen a lot of positive vaccine news over the past few weeks. You're warning, though, that we can't let our guard down just now because we are on the cusp of that vaccine being rolled out in Australia. What else should we be doing? What other measures need to be taken? Is New South Wales moving fast enough with restrictions, considering the current outbreak?
I think the important thing is to follow the rules that we've been trying to follow over the course of the last year, maintaining social distancing where possible, and of course getting tested if you have any symptoms that might be related to coronavirus or have been in contact with somebody who might have been in contact.
So following those rules, but in terms of looking at further restrictions, could they be necessary? Are you confident that the situation unfolding in Sydney is one that can be contained? We keep being told that the system there in Sydney is gold standard. Are you confident we can prevent another Melbourne-style outbreak?
The contact tracing component of our control measures is working a lot better now, and obviously it will be very heavily dependent on that to keep this outbreak in Sydney under control. The people have moved fast, and with the advantage now that we can also look at the virus type reasonably speedily, I think we should be able to control the outbreak there with the measures that are in place now.
Just looking at the vaccine rollout that we are expecting to start here in the earlier new year in Australia, if someone has the vaccine, can you clarify for us, if they do get infected with coronavirus, can they still transmit the virus to others? Is that clear yet?
That's not yet clear. What we do know is that some of the people in at least one of the clinical trials of the vaccine who had been vaccinated tested positive for the virus but didn't have any symptoms, which does suggest that they've become infected during the course of the time after they were vaccinated. Now, how infectious they are for other people, of course, is not known, but if they test positive for the virus, then there's a reasonable chance that they might be infectious for others. And since there was a significant number of people who had been vaccinated who did test positive for virus, so I think we have to assume at the moment that the vaccine is very good at protecting us from getting sick, but may not be quite so effective at preventing us spread the virus to other people.
How confident are you, Ian, in the safety of the vaccines being rolled out? Some people still do seem reluctant to line up to get the vaccine due to the quick turnaround of the development process.
Look, we have good data on safety in healthy adults, and that's really important because that's the majority of people that we'll be immunising. We still need to gather more safety data, but because of the urgency of getting vaccines in place, those extra safety data will be gathered as the vaccine programs are rolled out. We've already learned that some people who are highly allergic to known allergens have had allergic reactions to one at least of the vaccines already, and we'll learn further as time goes by whether there are anybody else that we should be not vaccinating. But right at the moment, the evidence is that the majority of healthy people have had the vaccine without any problems at all, and we should build on that given the severity of the infection.
And what is your expectation regarding the length of time it's actually going to take to get a majority of Australians vaccinated? It's a huge task rolling that out right across the country.
Yeah, look, if we model from how long it takes to get the flu vaccine out every year, I think realistically we're looking at 1 to 2 years before we've got the vast majority of the population vaccinated.
And what about immunity and how often we might need to get the jab? Could it be possible that we'll need annual or even 6-monthly jabs? Again, is this something that we simply have to wait and see?
Yes, I think we're going to have to wait and see on that one. At the moment, of course, we've only got reasonably short-term data on protection. We know that the antibodies that are induced by the infection don't last forever. And we also have some early data from the very earliest phase of the clinical trials that the antibody levels wane over time. But we don't yet know how much antibody we need to protect us, and therefore we're probably going to have to wait and see.
And what about the virus evolving? Are you concerned that as the virus evolves and we see different strains that could impact the efficacy of the vaccines, or is it likely that the vaccines will continue to be effective even as that virus continues to evolve?
The viruses are definitely evolving, and because of the nature of the virus, these RNA viruses, they do evolve over time. So far, none of those changes have led to a virus which is sufficiently different from the one that we started with to say that vaccines wouldn't work against it. There's always a possibility that the virus will shift substantially and become less susceptible to being protected against by vaccination. Obviously, that's one thing that we'll be watching out for. And we have at least a plan to cope with that, because one of the technologies we're using, the RNA technology for making vaccines, is one that could be relatively quickly turned to something else if there was a need for a change.
Dr. Frazer, you already mentioned the side effects we've seen for some allergy sufferers from the rollout in the UK. What else will you be watching really closely as we watch the vaccine being rolled out in the UK, in the US? Obviously, we have a lag time here. We have a few months to really gather all of that data and information before the rollout happens here. What else are you going to be looking for?
Look, the most important thing we need to look for is whether particular groups of people are well protected by the vaccine. I mean, the elderly are particularly vulnerable to the virus, but they may be also less susceptible to getting good immunity with vaccination, although up till now, up to 70-year-olds seems to be as effective as for younger adults. The other group we need to think about, of course, is children, because while they don't seem to get sick with the virus, they certainly can be infected by the virus, and therefore there's a real risk that they may be the source of future spread of the virus if all the adult population is vaccinated, but not everybody's protected. So we've got a lot to learn yet, but because of the severity of the infection for some people, I think it's quite appropriate that we're learning as we go, having demonstrated that vaccines are safe and effective in the majority of people.
Dr. Ian Frazer, appreciate you sharing your expertise with us on Afternoon Agenda. Thanks so much.
Thank you.